Assalamualaikum warahmatullahi wabarakatuh. We from Group 7 and we will present about mental health. My name is Arif Hakimi bin Nazaki and my matric number is CD20079. First, we go for introduction. Mental health is all about how people think, feel and behave. People with addiction, bipolar disorder, depression, anxiety and other illness that influence their thought, feeling and behavior can receive assistance from mental health professionals. Mental health is a condition of mental wellness that helps people to manage life stressors, realize their potential, learn and work effectively, and give back to their communities. It is a crucial element of health and well-being that support both our individual and group capacity to decide, form connection, and influence the world we live in. The absence of mental disease is only one aspect of mental wellness. It has variable degrees of difficulty and suffering. It is experienced differently by each individual and may have very social and therapeutic implications. It exists on a complex continuum. Mental health issues include psychosocial impairment, mental illness, and other mental states linked to a high level of suffering, functional limitation, or risk of self-harm. Although this is not always or necessarily the case, people with mental health disorder are more likely to have lower level of mental well-being.
Assalamualaikum, my name is Fahmi. So today we're going to talk about the mental health. The problem statement for what causes mental illness is first one is continuous social and economic pressure, childhood adversity, environment. So like environment, living in a stressful environment can strain your mental health. Things like living in poverty or having an abusive family put a lot of stress on your brain and often trigger mental health concerns. Stressful event like losing a loved one or being in a car accident. Childhood trauma. Even if you're no longer in a stressful environment, things that happened to you as a child can have an impact later in life. Complex PTSD is one particularly common mental health condition among people who grow up in abusive or neglectful environment. Negative thought. Constantly putting yourself down or expecting the worst can get you stuck in a circle of depression or anxiety. Unhealthy habits like not getting enough sleep or not eating.
Assalamualaikum. My name is Nabil Fikri bin Sharifuddin and today I will present about the objectives for mental health. For the first one is to raise awareness about the mental health continuum. How we can raise awareness? We have to encourage them to speak out about their symptoms and emotions and possibly seek help, neither from your family and friend. And for the second one is to reduce stigma associated with mental illness by beware of your attitude and behaviors and examine your own judgmental thinking reinforced by upbringing and society. For the third one is promote health seeking behaviors and emotional well-being practice. If we managing stress, fostering positive social connection, and taking care of physical and mental health, it may help all individuals maintain good emotional well-being. And for the final objective is to prevent suicide through individual education and outreach events. A wide variety of community groups and organizations, including schools, after-school programs, healthcare providers.
Hi, my name is Damil Aidin. I will present my part, which is significance of the issue. Mental health is a crucial aspect of overall health and well-being that deserves our attention and care. It speaks to our overall emotional, psychological, and social health. Our ability to function normal meets life challenge head on and uphold healthy interpersonal relationships is depend on our mental health. On the other hand, a mental health problem or disorder can have an effect on our thought, emotion, and behavior, leading to difficulty in functioning and impaired quality of life. Mental health issue can take many forms, from anxiety and depression to bipolar disorder and schizophrenia. This condition can be caused by a variety of factors, including genetic, environments, and life experience. Regardless of the cause, mental health issue can have serious consequences for individuals, including impaired functioning, reduced quality of life, and even suicide. Mental health issues are prevalent and can have significant personal, economic, and societal consequences. It is essential to reduce the stigma associated with mental health issue, improve access to mental health research and treatment options, and promote comprehensive approach to mental health and well-being. By doing so, we can help individual and society thrive and flourish. Thank you. That's all for me.